What are the causes and treatment of chronic fatigue syndrome? Let's talk about it. Chronic fatigue syndrome, also known as myalgic encephalitis, affects over 20 million people worldwide. There's not a single cause for chronic fatigue syndrome. In fact, there's multiple potential etiologies. The number one is infections. 1 out of 10 people who develop Epstein-Barr virus will develop chronic fatigue syndrome symptoms. Number 2, chronic production of cytokines. Cytokines are little hormones that your immune system produces to elicit an inflammatory immune response, and when produced continuously, may result in chronic fatigue syndrome symptoms. Low-functioning natural killer cells. Natural killer cells help you fight off infections and inflammation. When natural killer cells do not function properly to protect you, chronic fatigue syndrome symptoms may develop. Number 4, differences in markers of T cell activation. T cells both activate and suppress immune responses to infection. People with chronic fatigue syndrome have different T cell activity than people without chronic fatigue syndrome. Number 5, stress and a dysfunctional hypothalamic pituitary adrenal axis. Stress can trigger chronic fatigue syndrome symptoms and also make the symptoms much worse. The stress hormone cortisol helps lower inflammation and calms down the immune system. Patients with chronic fatigue syndrome tend to have low levels of cortisol, causing an increase in inflammation and chronic activation of the immune system. Number 6 is genetics. In twin studies in families, genes play a role in the symptoms of chronic fatigue. So how can you treat chronic fatigue syndrome? While conventional medicine treats chronic fatigue syndrome symptoms, I've found in my practice dealing with chronic fatigue syndrome patients for many years that supporting their hypothalamus with Genesis Gold and sometimes extra sacred 7 amino acids can reduce the inflammation, balance the immune system response, help the HPA axis normalize, balance cortisol levels, and improve mitochondrial function to increase energy. Treating the symptoms of chronic fatigue syndrome can help the patient become more functional until their hypothalamus optimizes. For instance, post-exertional malaise is an increase in fatigue after stress, emotional, or physical exertion. Post-exertional malaise can be mitigated by having patients pace their activities, by recognizing what triggers them, and also attempting activity during the time of day when they have a little more energy. Now, it's really important with chronic fatigue syndrome to address sleep issues. Along with practicing good sleep habits, supporting the hypothalamus nutraceutically helps to normalize nocturnal hormones and deepen sleep. But supporting the hypothalamus, the pain associated with chronic fatigue syndrome can often be mitigated as there's less immune and inflammatory response. Depression, anxiety, and poor stress tolerance are often symptoms of chronic fatigue syndrome that can be mitigated by hypothalamic support. Issues with memory and concentration can be improved as well with hypothalamic support. It helps to increase the production of dopamine. Mitigating orthostatic intolerance, which means your blood pressure goes down when you stand up, with fluids and salts can help, as well as compression stockings. Now, if you have any questions about chronic fatigue syndrome, please join us in our Hormone Reboot Training. I'll see you in the next video.